everybody. We're here at the New York, New Jersey Clinical Education Consortium Retreat, and we thought it would be a good idea to make a video about some of the things that experienced site coordinators of clinical education incorporate into their programs to facilitate both CI and student success. So I'm here with Kyle Davis from Spear Physical Therapy. Kyle, what's one tip that you guys incorporate in your program?
Yeah, great question. As Angela said, Director of Student Experience at Spear Physical Therapy. I think that one of the biggest things that we encourage all of our CIs to do, whether they're experienced, a newer CI, is a real emphasis on open communication. So each week we encourage them to have time that's actually protected on their schedule to have these conversations with students. So outside of just the clinical skill set, there's more hard skills. We'll talk a lot on how to have open communication, whether that's with patients, and we have actual kind of practice scenarios that we'll put students through, and communication with their CI too. So students are learning to be clinicians when they're out, learning to advocate for themselves, learning to ask for what they need. So we continue to encourage them to ask their CI for a bigger caseload, less of a caseload, more time with certain patients. And we found that that really contributes to their development while they're in our four walls.
Great.
One.
Right, I'm here with Angela from Rusk Rehabilitation, and Angela and I were talking about the importance of student communication. So I would love for you to be able to share your tips that we were talking about.
Yeah, so we do meet with our students and talk to them a little bit about how they're going to communicate with their CI. And we've also educated our CIs to listen for these things. So there are two things we talk about. One, we talk about how sometimes as the day is going in the clinic, you don't realize how much you've assigned that student to do at night. So what we've said to the students, a good cue to your CI that they may be giving you too much work to get done in an evening is, hi, we've been talking a lot about a lot of great things today, but I feel like I have a lot that I'm supposed to do. Can you help me prioritize my work for this evening? And that usually helps them understand, oh, maybe I gave them too much for one night, because certainly we want them to get some sleep and get some food so that they perform well in the clinic the next day. The second thing we talk about is feedback. So I know it's a tendency that a lot of us have when we're trying to help the student perform best, that we give a lot of constructive feedback. So the cue that we've given our students to say to the CI is, I've been getting a lot of really great constructive feedback from you about things that you want me to work on. Are there some things that you think that I'm doing well that I should continue to do with my patients? When the CI hears that, that's a cue that maybe the feedback hasn't been balanced enough.
Awesome, thank you so much for sharing that.
Hi, I'm here with Christina from Ivy Rehab, and Christina and I were talking about when it's time to talk to the school as a CI. So Christina, tell me what we were talking about.
Yeah, so as a CI, there comes points sometimes where you feel like the student may be struggling or falling behind or not meeting their competencies, but as a CI, you struggle to really reach out to the school. And my suggestion through experience and many conversations with CIs and educators is to reach out as soon as you have that feeling or those thoughts, because a lot of those issues can be headed off super early, and there can be easy solutions and early solutions to any barriers that you may be experiencing with your students. So it's highly recommended as soon as you have those thoughts or feelings, or you start navigating any issues with your students, that you just reach out to the school.
Yeah, they can help you navigate. That's such a great tip.
Absolutely, it's a good teamwork.
Nice.
All right, I am here with Stephen from Rusk Rehabilitation, and we were just having a great conversation about getting clinical rotation started off on the right foot and how to kind of continue that momentum throughout. So do you want to share what we were talking about?
Sure. It's really about that CI and the student forging a great relationship together, and how the CI can ask the student how they prefer to learn, right? Their preferred learning style will make sure that their communication is facilitated the best, and also when they like to receive feedback. Some students liked it right in the moment, and some like a little bit of summative feedback at the end. So it's really important. It establishes that really nice working relationship between the pair.
I love it. Communication is key.
Yep.